regarding the AMC, but at Academically, we provide assistance for USMLE and PLAB and AMC. So any exam you want to give, so we can help you, whether it is PLAB or USMLE. But today's webinar is for AMC. But if you have any question in your mind, if you want to compare with the USMLE or PLAB, then you can ask any doubt or any question for you. I will also try to wherever need, I can compare few points yeah, in this scenario, especially. Okay. So we are the Academically the Australian-based edtech company. So we provide assistance for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, physiotherapists, optometrists, veterinary doctors. So any healthcare degree holder, now if they want to migrate to Australia. So in general, there is three steps they need to complete for Australia. First, the document verification, then exam. For example, in case of medical doctor, you try this Australian Medical Council exam or AMC exam, or then you have to go for English test. These are the three tests you need to, the three steps you need to complete in order to migrate to Australia. It is the same for all healthcare professionals, whether you are a pharmacist and others also. So this is about me. So I'm basically a clinical pharmacology professor. So I have around 10 years of teaching experience, including India. In Malaysia, I work around 4 years. Last 6 years, I'm working, living here in Australia. And okay, so I'm guiding last 6 years to migrate to Australia, all healthcare professionals. Here are some of the faculties for this course. So Dr. Sipun Sharma is an Indian doctor. She is MBBS MD from India, Pune Government Medical College, and she passed this AMC journey. Now she is practicing here in Sydney. Same for Dr. Udara. She is basically from Sri Lanka. She passed the exam and she is practicing in Sydney. There's another doctor from Amman, and we also have two more lecturers here. I'm not showing their names here. Here are some of the faculties for this course. So the faculties basically they pass this journey. Now they are in Australia. They can guide you in a better way. Once you complete this process. So, for example, in case of UK, in UK you cannot get the PR. You have to work there for 3 years, live and work for 3 years. Then only you can apply. Same for US. Getting a green card is very tough in US, but in Australia it's very easy. You just need to pass this process, and you are eligible to apply your permanent residency in Australia, and then you can migrate with your family to Australia. And currently, a lot of jobs are available in Australia. Even AMA, Australian Medical Association, also mentioned there's a lot of jobs are available. It's going to be a shortage in Australia, and salary is very high. This is basically a GP salary on an average, but general physician, we're not talking specialists earn up to 600,000 Australian dollar, or we can say more than 3 CR per year. For example, neurosurgeon, they earn a lot. Okay. So in Australia, after AMC Part 1 or AMC MCQ or Australian Medical Council MCQ exam, you are eligible to practice in Australia. You can work in Australia. In UK, you cannot work. In UK, you need to pass Part 2 as well. And that Part 2, you need to go to UK to pass that exam, OSCE exam. Then only you can start looking a job in UK. Same for US, you have to pass that the USMLE Part 1 and Part 2, and then start looking the match, in US. So Australia, the only country they allow to work after Part 1 exam. Okay. And on an average salary, you will get around 80 to 120,000 based on your previous experience and your degrees. Okay. Uh, so you can work in Australia as a GMO, junior medical officer or resident medical officer. You can work after Part 1 itself. And this is basically a 9 to 5 job, 40 hours weekly, 8 hours per day, 5 days you need to work. And if you are working in Saturday or after hours, your salary is going to be 1.5x for that day. Or if you are working in Sunday, you're going to get a 2x salary for the particular day. So in Australia, for example, if you are from India, Pakistan, Nepal, so in our countries, there is no such limitation. You can see a patient 100, 200, 300, doesn't matter there, okay? But here in Australia, you have to maintain the quality and safety of this patient. You're allowed to see per day 60 patients only. Okay, so you can treat 60 patients per day maximum in Australia as a GP. And the payment received from the government for per in Australia, healthcare is free for a patient. For example, if I am a patient, I'm an Australian resident. So if I want to, if anything happened to me, I want to go to GP clinic. I do not need to pay anything for them. I just need to show my green card, or we can say Medicare card, and they will charge the fee to the government of Australia. Okay, that's why here is the fee. And these are basically you have to work around 40 hours weekly for 5 days, 8 hours per day. So this the money basically 21 to $250 based on, like, what are the conditions for the patient, what are procedures you are performing, based on that they decide for. I mean, they're basically already specified. So on an average, if you can see 40 patient per day, and we are seeing that most of the your patient are just general conditions only, that even if you are receiving, still you can make a very good money. This is the Indian rupees. I calculate this much. You can see. So I met from the basically GP here. They are my friends. So I talked to them, and they are saying they, in general, around 40 for 42, 45 patients they see per day. Okay, and they receive this much money. So this is like a decent money they are earning in Australia as a GP. I'm not talking about the, especially if you are a surgeon or pediatric or option gynae or other clinical branches. Even if you see here, there is a medical officer salary 100,000 plus. This is a very good salary, I can say. So they are saying minimum this much, and maximum they are saying up to 200,000 around. They are mentioning you are going to get. And on an average per hour salary, if you see here, so you can see here minimum entry level $55 per hour, and maximum we can say 100, around $100 per hour salary for resident medical officer. And a resident medical officer means that you can work after part one, even after part two as well. So there is a some other advantages to migrate to Australia. First of all, the education for kids are free in Australia. There's a lot of good schools here, universities in Australia, and healthcare access are free in Australia, as I mentioned earlier. And professional development. So if you want to do any short training, or if you want to attend any workshop, you want to attend any conference, so the hospitals they encourage to attend and update yourself. And work-life balance, as I mentioned, that you need to work around 8 hours per day. So you have a lot of time to give your family, friends, and your family, all those things. Career opportunities, a lot of basically high demand for healthcare professionals. That's why they are giving the fast track to their visa for the healthcare professionals. Quality of life, obviously, you can see here, maximum people are migrating here. Those are doctors are working in Australia. They are migrating from UK. Lot of UK trained doctors are working in Australia, and same for like from New Zealand. So many high income countries doctors are migrating to Australia, and higher potential of earning in Australia. And so these are some of the steps you need to complete in order to migrate to Australia. So this is called first step, document verification. Okay. So we will help you to complete this process. So no need to worry about, I know you guys are very busy. So we have a team. They will complete this process for you. And then the next step, you have to write this AMC exam. Okay. Australian Medical Council exam, part one. This is an MCQ based exam, and you can write in your home country. Okay. And once you pass this exam and plus English, then you have to apply for a limited registration. Okay. And once you got this, then you are eligible to apply jobs in Australia as a GMO, junior medical officer, or resident medical officer. You can work. Okay. And to get a full registration in Australia, you need to pass AMC Part 2. Okay. So many doctors basically they ask me this question that, sir, is there any alternate for AMC Part 2? So in that case, if you do not want to give AMC Part 2, you can go for WBA program, Work-Based Assessment Program. So there is in 19 hospitals in Australia, Government of Australia or AMC is approved, these 19 hospitals. You can practice there, you can work there. And this is kind of like your internship you did in your MBBS during your internship. For example, there is a four different departments you have to choose, and 2 months you have to be stay in it around from 45 to 50 days basically per department you have to go, and there will be one mentor for you, and there are the other healthcare professionals how you are working with them. They will give you report on your work, and at the end of this WBA, you will get basically one viva kind of viva, and the passing rate for this WBA program can say around 99% student part in this, unless you did some big blender or something in the hospital, unless you will pass it. WBA is very easy if you are lucky to get it WBA. Otherwise, you can go for AMC at any time. Okay, you will get the full registration here. Then now many doctors they want me this question says I want to do PG in Australia. Okay, so once you got full registration, and now you have to work basically for 1 year as a resident medical officer. This is mandatory for everyone after part 2. This also can be vary for individual person. So this APRA will see your CV, your experience previously, and based on that, they might give you, that how much time you need to go for this training. But on an average, you have to, if someone did MBBS from home country like India, Pakistan, or Nepal, you need to go for 1 year. Okay, and after this 1 year, then you have to apply this. Basically these there's some around some schools is here around 11 schools here in Australia, so you have to apply individually. I can show you here some list of the schools. So if you want to apply that PG, so you can go for these specialist medical college we call in here in Australia. So, for example, if you want to apply emergency medicine, you want to be a specialist in emergency medicine, you have to apply to ACEM. Or if you want to be a general practitioner, then you have to apply RSCGP. Okay, so like this, you have to be critical care here, different administrations. You can have a look. For example, if you want to be a surgeon, then you have to apply the Royal Australian College of Surgeons, RACS. So here you have to apply. So you just need to pass part one AMC or part two or WBA. Then 1 year you have to work as a resident medical officer. Then you have to apply for these specialties you can apply. Then the workplace assessment always hired by a government. Many state they are hiring. So you can have a look here. This is the Western Australia government is hiring, and they are just asking you pass AMC this exam part one, and you are eligible to apply. These are some of the basically website where you can find a lot of jobs are available in the government sector as a GMO, junior medical officer, or resident medical officers. So these exams you can write 10 times in a year. So and there is so many exam centers in India, 15 exam centers currently in India. And if you do not have the exam center in your home country, you can go to nearby country. But if you compare this to PLAB, UK, so getting a date is very difficult in UK. You might need to wait maybe 1 year and more than that to sit in the exam. But here is very easy whenever you are confident. Uh, we also take a basically a lot of mock test. We provide you live classes. Plus, we will record you those classes if you are miss any class, if you are in hospital or something, you are on duty. And we also provide a study material. Plus, we will provide a lot of mock tests based on individual subject, and we will have a lot of practice questions from a previous year question paper. So very easy will make your journey for this AMC exam. So this is the advantage in AMC. Lot of exam centers, monthly exams you can write. You feel confident, just book the exam and can write. The English is very important here. So OET or IELTS or PT you can write for AMC. But in case of PLAB, you need to go to IELTS or OET only. Okay. There's no PT or PT is not valid in UK, but here in PT also valid. So easier exam for you PT or OET. Okay, and we need your degree, transcript, work experience if you have any, valid passport, government ID, passport size photograph, medical registration certificate, and all these documents required. So there's a 150 questions, multiple choice questions they will ask, and there is 3 hour time. So on an average, in 1 hour, you have to correct 50 answers, and you cannot skip any questions. You have to attend all 150 questions. If you miss any question, this is they consider incomplete your result. I mean your paper, and they will not. The system will not mark for your paper. So you have to attend all 150 questions within 3 hours. So there is a scale basically 0 to 500, and you have to score at least 250 to in order to pass this exam. So on an average, we can say the 50% you need to correct to pass this exam, and there's no negative marking. Okay, so you have to attend all questions, and the questions is not they give the equal weightage for the each question. So one question might be for 1 mark, another question might be a 2 mark, might be some question might be 1.5 mark. Okay, so you don't know, but this is like internally they will analyze your result. So we will provide the 4 month coaching, 15 weeks basically to complete this syllabus, plus the mock test and revision and all, including all those things. This 4 months is enough to pass this exam, to clear this AMC exam. And once you complete this, you pass AMC 1 and AMC 2 or WBA plus 1 year, you completed this residency also, then you are eligible to apply your PR visa like 190, 186, and 189 PR visa. You also can apply one work visa like 482, 494, or 491 visa, regional sponsored visa. In all those visas, you are eligible. Here are some of the media coverage about academically. And yeah, fees will give our team to give you the more information. And we also provide the financial assistance basically. So you can pay our fees in 3 months, 6 months, 9 months, or 12 months without paying any interest to us. Some of the reviews from our students. So I think I can talk to you now one on one. So if you have any specific questions to me, and we have a one YouTube channel dedicatedly for AMC. So if you are looking to migrate to Australia, so you can basically subscribe this channel. So you will find a lot of videos. This is for PLAB, AMC, USM related content only. We update on this website. So this is Academically.MedPrep. So please subscribe this channel to get update regarding the opportunities for you in abroad. Okay, guys. So now we can talk one on one. Yes, please, Dr. Anurag.
I just wanted to know, when we participate in your course, is it okay for us to pay through India or through Nepal, or do we have to pay through Australia, so in Australian dollars?
Mm. We are Australian companies. Obviously, in our website, we give this AUD you need to pay, but Nepalese students have some problem because their government is not allowed to send the money. So we also allow you, some money you can pay in Indian account as well. We can help you in that. To just give us your information, so our team will contact you.
Okay, and I have another question.
Yeah, sure.
Do you guys provide question banks as well?
Yes,
So is that based on past recall or like through
this is
question
mix up.
banks like
This,
Amidex or M plus X?
this is mix up. Previous year question paper, MDX, we have our own questions as well, our faculty questions.
Okay.
Yeah.
Sir, I have one question.
Yes, Preetham.
Sir, I have already done OET and I passed it. Sir, how much time
B
it is
grade,
valid for?
B grade, and 2 years. Any English test, whether it is IELTS, OET, or PT, is
Okay.
valid for 2 years only.
Okay, so sir, now how can I subscribe this sir AMC course from your site?
Yes, so you can just give us your phone number, email in our chat box. So we
Yes,
will
sir.
connect to you. Or I think our team will give into you this link, right? How
Okay.
you got this link?
Okay, sir. Okay, sir. Thank you very much. Okay.
Okay, thank you.
Uh, Thank you, sir, for this
Thank
wonderful presentation you gave.
thank you so much.
Sir, I just have a doubt. Can you please tell about your success rate in this AMC exam? Like you had given about CAPS, that was for pharmacy. Like that, what is the
Caps
success rate in
basically,
AMC?
caps we are running basically last more than 2 years. So we have several batches for that, you know. So we follow the same strategies for all the exams, even for AMC. So far AMC, this is our third batch. The students are going to sit in in the February. There's so many students. So not yet students sit in this AMC exam. So we do not have any data for this, but we have a track record. You know, the other exams very high. So we follow the same strategies for this as well, same like as CAPS.
Okay, sir. Thank you, sir.
We will basically give you the live session or the content, the study material. Then the you have to practice basically on previous year question paper. They have our on MCQ basically the Q bank. So yes, next please.
Good morning, sir.
Yeah, Dr. Niti, how are you?
I'm great, sir. So thank you for your presentation. I have a few questions, sir. The first is, like you said, like for someone with a long gap in clinical would be difficult. Does it mean that they would not want such candidates, or it is the difficulty for
No,
the?
I mean, for example, someone graduated 2010.
Okay, okay,
Last 6 years, if he is not practicing.
okay,
You know, if he's practicing, that is very good, excellent profile. If someone is not practicing, he's doing something business, something else, like not in
okay,
medical. So
okay,
in that case, you cannot justify that 10 years is a long gap. Whatever
uh,
you study in your medical school, everything is like you forget the things. They will
okay,
not allow such applications. But for example, woman, for example, you married and you like pregnancy, this and that. If you have a little bit gap, like maybe 1 year, that can be justifiable. But this is
uh,
not like a very long gap, you cannot justify the last 10 years you are not working, why not working in the field?
Yeah, yes, I'm coming for this question because I've done a master's in one of the basic science. My master's MD is in one of the basic science program. So it's not particularly clinical per se, but does it qualify or does it bring some kind of red flag to them?
No. Still, you can basically, if you are studying, and for example, you are doing Master of Public Health, for example,
Yeah,
yeah, maybe anatomy, physiology, or any non-clinical branch you are
yeah,
pursuing. Still, but the gap means you are not studying at that time, and also, you are not nothing you are doing basically.
Okay. So yeah, my other question is, you said like after AMC one, you can apply for jobs and you can start working. Like, how difficult is it, or how competitive
This,
is?
this is based on your own CV. It is
Um,
very easy. Many doctors they got in one way. Even our own faculty, Dr. Swipnil Sharma, she
yeah.
got within 1 month the job. She's an
Uh,
MBBS MD from India. Okay,
okay.
so getting a job also depend on they will between your interview basically. Mostly interview on via the Zoom or like we are doing right currently.
Okay.
So if you perform well, definitely there's a good chance.
So,
And importantly, you must be open to work in regional area.
okay.
If you are open, there's a good chance. But if you many doctors they think that's my sister or my cousin living in Sydney, so I only want to work in Sydney only. So
Okay.
in that case, it's difficult for you.
Okay. Thank you, sir. So, and lastly, so do they sponsor your visa and everything if we get a job in that form?
Yes. So in that case, they will sponsor work visa.
Okay. Okay. Thank you, sir.
Thank you.
Sir, one
Otherwise,
more question.
otherwise, you need to come on like visit visa to write this part two, or if you can clear part two from India itself. I mentioned that nowadays Australia is very easy. Even part two also you can write from India.
Okay.
For example, PLAB UK. UK you need to go to UK, then only you can write that PLAB too, and a lot of expenses and during this time for you.
Yeah. Thank you. Thank you,
Yes,
sir.
thank you. Dr. Pritam, yes, please.
Sir, one more question. Sir, I have generally gap in between the internship. Sir, would it matter in the getting the registration from the
Can you
Australia, sir?
please repeat again? Your voice is breaking. Or maybe you can
Okay,
just
sir.
type your question in the chat
Okay,
so I
sir.
can.
Okay, sir. Okay, sure, sir. Sure.
I think you are asking that there is some gap while you are doing your internship. I'm correct?
Yes, sir. Yes, yes, sir. Yeah.
What does this mean? I mean, your internship, you did MBBS from which country?
I did from Bangladesh, sir, but my internship is complete, sir. But in between the internship, there is some gap, sir. That's why I'm asking, sir.
I mean, how much is gap? It's like a few years or a few months?
No, sir. It's like in months, sir.
No, no, then not a problem. You can make a story
Okay.
basically, something happened to
Yes,
your
sir.
family.
Yeah.
You are
I had a,
supported. This
I
will
have a
be
solid reason for that, sir, and I can.
then,
I think
then
I can get.
not a problem. Basically, if there is a long gap, for example,
Yes,
three
sir.
years gap,
No, no, sir. It's not like that. Sir.
then
It's
you
just
cannot
9 months.
justify that 3 years gap.
Yes,
Why?
yes,
Like
sir.
this.
It's 9 months gap, sir. It's justifiable, and I
No,
can get a letter from
if
the
it
college.
is a few months, definitely you can justify.
Okay, sir. Okay, thank you, sir. Thank you.
Thank
Thank
you.
you.
Yes, Dr. Farad.
Hello, sir.
Hello.
Thank you for the presentation, sir. Actually, I had word with Mayank Mrinal from your team, sir.
Yes, Mayank, yeah.
Yeah, already I booked my seat for December 4th batch. So, what's the duration of the course, sir, in total?
Around 3.5 months around.
Okay. And, sir, lastly, like if after.
Actually, the we cover around 10 hours live lectures weekly. Okay,
Okay, okay,
8 to 10 hours. So if we
okay,
are taking more hours, it might little bit shorter. Otherwise, it may go around up to 4 months.
okay.
Yes, next question.
So, after, suppose if I clear AMC, sorry.
Yes. I mean, your voice is breaking. Can you please
Uh,
continue?
okay, like if suppose if I'm clearing AMC part one, and if I got a job opportunity over there in Australia, so is that easy to get a dependent visa or spouse visa or a
No,
single?
I mean, any visa if you are coming to Australia, for example, you got a work visa. If you got a job,
Yeah.
then you will get a work visa. So definitely that dependent you can bring. Even
Okay,
if you are coming here, for example, study visa, still you
okay,
can bring your spouse. So
okay,
study visa, you need to choose a master degree at least for 2 years. For example, if you are coming on Master of Public Health,
okay,
study visa, still your dependent can come, and dependent have a full work right in Australia. So your dependent can work here in Australia.
okay, okay. Thank you, sir. Thank
Even if you are coming on work visa or study visa, uh, or PR visa, so
you. Okay.
dependent will come. Dependent means husband and kids or wife. Okay,
Yeah.
not
Okay.
parents. Okay,
Okay.
many
Okay.
students basically ask me this question, so I'm just elaborating. So parent will not count on you as a dependent, but once you got your PR visa, you are in Australia. After that, you can call to your family as well. But
Okay.
the beginning days, your husband or wife or kids all together, you can come to Australia.
Okay. Okay. Thank you, sir.
Thank you.
So on December 4th batch will be starting, right?
Yes, I think Mayank will give more information. I think I don't know when we are going to start. Yeah, I think 4 5 only.
Okay. Okay.
You will receive the email and text and each and everything.
Okay, sir. Okay. Thank you.
Okay, thank you.
Hi, sir.
Hi, Akmal.
Hi,
Thank you,
doctor.
sir. Thank you for your presentation, sir. Sir, I want to know how long is the specialist pathway in the Australia if anybody wants to
3 to 6 years.
become.
ये जितने भी हाई इनकम कंट्रीज होता है ना, यूएस, यूके, ऑस्ट्रेलिया, कनाडा, इवन यूरोप, सब जगह पे स्पेशलिस्ट
Yes, sir.
पाथवे 3 to 6 years.
Okay, sir.
It
And
depends
sir,
on
how many?
स्पेशलिटी में होता है. For example, if you want to become a surgeon,
Yes, sir.
in surgeon also you want to become very something specialist, so in that it may take around 5 years.
Okay, sir.
But
Thank you.
during that
And sir,
stage, you are getting paid, so you are not basically just studying, and you are getting very good salary. I can say 120, 130, 140,000 per year. So it's not, so even if it is 4 or 5 years, it is worth, I can say.
Okay, thank you, sir. And sir, how many hours of study are required on daily basis for the 15 weeks you mentioned that your
At
course is
least,
about
at least
15 weeks?
you need to give. Basically, we will take a 2 hour lecture, for example.
Okay, sir.
Okay? And apart from this lecture, we are expecting at least 4 to 5 hours per day for 90 days at least. Or if you want to give more time, for example, you want to be sit in 5 months. For example, we'll give 4 months,
Okay.
and then again you want to revise for yourself for 1 month, then you can go in the exam. So maximum
Okay.
doctors, they are doing the same thing around 5 months on an average. They are booking the exam and they're going to it. So the exam basically in December or January there is no exam. Okay.
Okay, sir.
Then February to
Okay.
November, whenever you feel confident and you can book the exam, you can write. And there are so many exam centers basically.
Okay, thank you, sir. And sir, how much is your subscription for someone from Pakistan?
This will give you our team. Basically, this is giving the scholarship also. So you just give us your phone number, email in the chat box. Arindam, Arindam is our manager is here, but I think Mayank or someone is already in contact with you, right? So he will
Okay,
give
thank
you
you,
the
sir.
more information regarding the apart from fees. You can ask me any other question. Sorry,
Thank you, sir. Thank you. That's it, sir.
thank you.
Hi, doctor. This is
Thanks,
Ajmal
Akram.
over here.
Yeah.
I have two questions. The first question is regarding the part two. Uh, what is the pass percentage that is usually running for part two, and the duration of preparation for part two?
Basically, part two, basically it is a OSCE exam, right? So there is a
Yes.
around 16 stations.
जो एएमसी का पार्ट 2 है ना वो ऑस्की एग्जाम है क्लिनिकल वहां जाके देना पड़ेगा
नहीं
Yeah,
नहीं
I understand that. Yeah.
yeah. I mean, this is a part two exam.
मुझे टेंशन नहीं है मैं बहुत अच्छा हूँ ऑस्की
एक मिनट ये तो बोल रहा था भाई. Yes, so this is part two exam. This is OSCE exam, right? Even the other exam, part two, for example, this lab, you need to go to UK. But in Australia, they are allowing even you can give online as well. Okay. So the passing rate little bit low for this. The reason around 30% student pass in this. 30 to around 40%. This AMC part two. The reason what we are doing the practice in our home country is totally different from here in the Australia what we are following. So for example, I can give you one very very small example for you. You are working in a hospital and someone died in the hospital. So how you are going to inform that in that patient relatives in India you can say कुछ भी बोल सकते हो आप इंडिया में, but here you cannot. So that things you need to learn for that. So there is each station is here and they will do your assessment. So based to skip that WBA program also in Australia. There is no other country allows such program. You can go WBA if you think that. Uh, so still I can say if you see that in India we give like um, the other exams like IAS exam. There are 12 lakh people are sitting in this exam every year, and only 800 seats is there. So you see, the competition is very very high. But here 30%, 40% is passing. I can say part two. Part one is around 60 to 70% pass. Okay? So it still is very good number. I can say it's not very low or something. Or maybe you can go for WB as well.
Okay. And the second part, as I said, the duration of training that would be needed for part two.
Yes, actually we are waiting. Some of the students are passed from academically. Okay, so basically, as I mentioned, maximum students are going to sit in the February. Once they pass, then we will start this part two. So part two, in general, we will provide coaching around for 1 month only. It's not very long or something. So you already know each and everything. So we are just helping you, the things how basically you have to be, your communications and all those things only. Those are very important in Australia. We will give the guidance especially.
Okay, sir. And the second question is this WBA assessment, does it have a slot, limited number of seats, or anything like that?
19
Uh,
hospitals is there. Okay. So each hospital they have their own requirement. So basically hospitals का problem क्या है? They are not getting enough doctors. So they want at least someone has to work there for 1 year as a JMO or RMO. Then they will give you that WBA seat. So at least you can work in that particular hospital for 2 years at least. The- A salary they will give you. I mean, that's not a problem. You are earning, you are working. So there's a limited seat, limited hospitals only you can work. 19 hospitals. So I always actually encourage to apply for those hospitals only first. Those 19 hospitals. Do not apply WBA. Apply for job. Ask for job as a GMO or RMO. If you able to crack that interview and getting a job at those 19 hospitals, very easily you can shift to the WBA program.
Okay, great. Thank you, sir.
Yes, next please.
So some questions are there on the chat.
Acha. Aditya, being a fresher, I don't trouble finding a job after MC1. Then I can do. I mean, this is not AMC1, So if you have some experience in your home country, at least 6 months, 1 year, and you are performing well, and your CV meet me, if you can do some research as well. Here they are only they do not see only just the clinical experience. The problem in our doctors in India or around those countries, they are only focusing on clinical things. They are not focusing on the other things like to do some research. The other involvement to upgrade the medical field. So if you have some publication, definitely can help you. So Anurag, yes. So basically in if you want to do PG in Australia in any clinical branch, so you need to pass AMC Part 1 or AMC Part 2 or WBA, get your full registration for 1 year. Then after that, you have to apply for residency. So this is the process in Australia. Yes, so is asking basically any work experience in the home country will support in finding a job after MC1. Yes, definitely. So if you have, for example, someone have 5 year experience after MBBS in the home country, you are working as a medical officer in government or any private hospital, any nursing home, something, definitely there's a very good chance for you. If you have experience after your MBBS, there will be a good chance for you to getting a job. And Dr. Vikas, I'm graduating from Beijing 2021. Then I started mass manufacturing. अगर आप कोई जॉब ही नहीं कर रहे हो 2022 really you have to must work. If you are a doctor, you must work. Whether even without registration, if you are something helping, you can say that I was doing some observership, for example. You have to don't give any gap in the CV. So if you any small nursing home or your friend or something, so you can show that you was working there in something. So don't leave basically blank in your space in your CV. 2, 3, 4, 5 months is okay, but not more than that. Sheikh Naseem, please yes, please share your phone number, email in the chat box, so we can connect to you individually. Fatima CV are allowed or in Australia. MRCP, you have to again go specialist. Though there is a two pathway in Australia. One is standard pathway, another one is a specialist pathway. Actually, there is a four pathway in general. Another one is a short-term training pathway there. So, इसमें क्या है कि if you have at least 8 to 10 year experience after your PG, for example, if you did your MD or MS in your home country, you are a specialist here. Please mute everyone and unmute when you have any questions. So, so specialist pathway can basically get if you have a long basically experience 8 to 10 years. Otherwise, you have to go to the this pathway only, SNET pathway only, to at AMC 1, AMC. As I mentioned, that our own faculty, Dr. Supreme Sharma, she's also MBBS MD from India. She worked around 4 years in India. After that, also she wrote this AMC exam. Now she's working. So, अगर आपके पास में after 3, 4, 5 year experience है, then you have to go to a specialist. Sorry, this SNET pathway only. But if you have more than that and you have CV is very strong, in that case, you can apply for specialist pathway, and in that case, no need to write AMC exam. And for that, you just go to AMC website and you can find that this is the procedure, basically same for epic verification. Then you have to apply for a specific college, as I mentioned earlier, I just showed earlier. Yes, so if you want to sit in the AMC part 1, English is not required to sit AMC exam. Okay, you can give English test after you pass this AMC. So OET is not required. OET or PTE or IELTS not required to sit in this AMC exam. So, please give us your phone number, email in the chat box. So our team will connect to you immediately after this conversation. Okay, so they will give you the more detail regarding the fees and all those things. Yes, you can unmute guys and can ask directly. So WBA program ka, there is no such criteria. They will see your AMC part 1 pass, and if you have some experience, they will give the preference for them the first, at least minimum 6 months to 1 year after your MBBS.
Sir, I have a doubt.
Yes, please.
Sir, what should be the ideal time between this appearing for AMC Part 2 after clearing AMC Part 1?
Whenever you feel, there's no such a timeline basically, but I can say at least you can take 3 months at least to give to appear in the at least in the part 2, 3, 4 months.
Thank you, sir.
Thank you.
Hello, sir.
Yes, Amna.
Sir, how much time it will take for a fresh graduate for this to appear for this exam? Like, sir,
Mean,
I have completed my internship in September
yeah, so basically
this year.
the requirement
So,
to sit in this
yes,
exam, you must complete your degree, plus you must have a registration to practice in your home country. So you must be RMP in your
yes,
home country. So if your registration already done, then you are eligible to sit in this.
yes, sir. Yes, sir, it's already done.
Just then you are eligible.
Okay, sir.
Sir, do you have any study group or any sort of Telegram group or anything where the students who have subscribed to your course preparing for AMC Part 1? Is there
Yes,
anything like that?
those are our students. We have our own community portal on Discord. So all the students will be there. Those
Like any
joining
Hello,
other,
sir.
like Telegram or any other social
Discord,
media?
Discord we use, and even we have, I think, uh, we have other thing, our WhatsApp group.
Sir, can you please add me at least to the one of these WhatsApp group?
Yeah, yeah. Uh,
I
Arindam,
have given
so
my details.
yeah,
Yes.
sure. Please share in this our chat box.
Okay, sir. Thank you, sir.
Hello, sir. This is Dr. Snan from Pakistan. I wanted to ask, there is no exam center in Pakistan, So,
So you
what
have
if
to
we
go
need to
to
go to?
nearby country. For example,
What if we? Yeah, I know, sir. Like Thailand, China, or I think it's also not in Dubai. Exam centers there. But what if we go to Australia? Do we need to apply for visit visa, or based on
visit
AMC
visit
exam
visa.
booking, we can travel to Australia?
Yes, you can apply for visit visa.
But AMC on based on AMC exam booking, they will
Yes,
not give us the visa.
they can give. But the problem
Oh,
in your country, many Pakistanis are coming here and they are doing illegal things. They are coming and they are vanish here in Australia. So that's why they are
yeah.
very careful to give a visa. Especially the young guys.
Mm-hmm.
But if you applied for this AMC, there is a good chance I can say you can get at least this visa.
Mm-hmm. What if we pass the AMC exam one and we go to for giving exam we go to Australia and is it good to apply for the job from there in Australia after passing the exam? Is
Yes,
it good idea?
if you are in, so you can come on a study visa simply to Australia and can uh, pass AMC Part One from home country, come study visa very easily for you. You can settle down. So if
Mm-hmm.
anyone pass Part One and you are on a study visa, so observership easily you can find. Lot of Pakistani doctor, Indian doctor, they are working practicing here in Australia. So you can ask some of them. Definitely they will allow some days, and if they find suitable for you, they will allow you to work in their hospital particularly.
As like study like MPH or administration
Yes,
fields.
MPHU. Any we can I can
Uh,
say the low cost course है, affordable course. For example, Master of
mhm.
Public Health, वो कोर्स आप आ सकते हो.
The master in public health is not so cheap. Its fees is about 15,000 AUD
So this is very very low.
per
This is
semester.
master degree. This is the
Per
lowest.
semester, I think.
Hmm, this is the lowest fees
Oh,
basically
oh,
a course in Australia.
oh, okay. Thank you so much.
Thank you. Yes. Any other doubt किसी का है कोई?
Hello, sir.
Yes, Ayush.
Sorry, sir. Actually, I missed the presentation. Sir, actually, I wanted to ask you right now, I'm in my final year of MBBS. So,
Okay.
right now, like recently, somebody asked about that. So, it is necessary, right, sir? I need to go to India and like I have to get that paper and be done with my internship. Then only I can apply for this exam, right? So,
No. Basically, there are two things. If you are from any Russia, China, those kind of
yeah,
country, if you
I am studying in Georgia, sir.
yes. So in that case, no need to complete the intern. If you can complete internship or clerkship in your during your internship, during your MBBS, then no need to do again.
Okay, so like they will accept the internship from here also if I
Yes,
have
yes,
that from here, Georgia.
yes. So your college must be approved by the MC the AMC. तो पहले तो आप अपने कॉलेज का नाम देखोगे कि आपके कॉलेज का अगर नाम है वहाँ पर, then you are
Okay, sir.
eligible, and they will see basically so some college they are saying the approved qualification like 6 year, 5 years, or 7 years. So your course duration also must be the same.
Yeah, so we have the 6 year course duration here.
Yes, so 6 years if you then you are eligible.
Okay, sir.
Okay, thank you.
Thank you, sir.
Yes, किसी का कोई और क्वेश्चन है?
I have a question. I want to appear for AMC, and I have a 2 year clinical experience in my country, Pakistan. I have a family with me. I have 2 kids and a husband. The thing is that how can they join me after AMC one if I get a job
If you
in
got a
Australia?
job,
And
this is a work visa. Okay, so whenever you are applying any visa in Australia, they will ask you, are you single or married? And if you say you are a married, then obviously then your partner will go with you. जितने भी डिपेंडेंट्स होते हैं उनको वीजा मिलती है, वेदर इट इज वर्क वीजा पे आप आओ, इवन इफ यू आर कमिंग हियर टू स्टडी, अगर आप कोई यहाँ पर छोटा कोर्स भी स्टडी करना है तो फॉर एग्जांपल मास्टर ऑफ पब्लिक हेल्थ, उस केस में भी आपके हस्बैंड को अपने बच्चों को भी आपको वीजा मिलेगा.
or is it easy to get a job after AMC one? It's like if I apply from Pakistan, I've heard it takes time a lot. Like 70% ratio people are getting
नहीं
jobs
होता
there.
इजी नहीं, जो
30% won't
पाकिस्तानी
get.
सिटीजन आपकी अपनी कंट्री में जॉब मिलना इजी नहीं है, तो यहाँ कैसे इजी हो सकता है? इजी कुछ नहीं होता है, बट नॉट ए सिंगल स्टूडेंट
It's
ऐसा
like you have to
एग्जाम
keep
पास
trying.
कि उसको जॉब नहीं मिल रही है. जॉब सबको मिल जाती है, तो अगर आपको नहीं मिले तो आप जो है पार्ट टू क्लियर करोगे आप, आपको जर्नी ऑस्ट्रेलिया तो अलाउ कर रहा है एटलीस्ट वर्क करने के लिए आफ्टर पार्ट वन. यूके डज नॉट अलाउ, यूएस भी अलाउ नहीं करता. वहाँ पार्ट 2 के बाद ही आप
हम्म
अप्लाई करोगे, और वहाँ पर भी ईजी नहीं है। यूके में सैचुरेशन हो गई, वहाँ जॉब भी नहीं मिल रही है। सेम फॉर यूएस आल्सो। तो ईजी तो कहीं नहीं होता किसी भी हाई इनकम कंट्री में, पर ऐसा भी नहीं है, इम्पॉसिबल नहीं है। हर साल बच्चे आ रहे हैं, पास करे, सबको जॉब भी मिल रही है। ऐसा नहीं है कि किसी को जॉब ही नहीं मिल रही है यहाँ पर, जो लोग वापस जा रहे हैं, ऐसा है ही नहीं।
So I just want to confirm one thing about the family visa thing and all. Is it a is yeah, like is it will be an issue for the hospital that will give me a job or not? Because this thing is confusing me a lot, and this is the
हॉस्पिटल
reason I'm not going for the MC one.
हॉस्पिटल वेदर इट इज यूएस या यूके या ऑस्ट्रेलिया, कहीं भी कोई भी कंट्री होगी, तो मैन एप्लीकेंट को वीजा देते हैं। जब आप अप्लाई करते हो तो आप बताते हो कि यू आर डिपेंडेंट और भी आपके साथ में, तो उनको ऑटोमेटिकली वीजा मिल जाता है। अब हॉस्पिटल तो आपको एक्स्ट्रा एक्स्ट्रा सैलरी देगा नहीं कि आपके हस्बैंड भी आ रहे, बच्चे साथ में आ रहे, तो जो भी सैलरी देंगे सेम ही सैलरी देंगे ऑब्वियसली। तो उनको कोई प्रॉब्लम थोड़ी नहीं है, उनको पता ही होता है, वैसे भी डॉक्टर्स की फैमिली होती है जितने भी हैं, तो वो वीज़ा मिलता ही मिलता है। इवन आपकी वो है या नहीं, मैंने बताया कि अगर आप स्टूडेंट वीज़ा पे भी आते हो यहाँ पर, तो अभी डिपेंडेंट्स को वीज़ा मिलता है। मैं खुद यहाँ पे आया था स्टडी करने, पीएचडी करने, मेरी वाइफ बाद में मेरे को ज्वाइन किया उन्होंने, है ना। तो यहाँ पर बहुत ही कॉमन है ऑस्ट्रेलिया में कि डिपेंडेंट्स को वीज़ा मिलता ही मिलता है।
I see. Or is there any WhatsApp group where we can prepare for the exam? I mean, there might be helpful.
No, we have our own internal groups once you join this academically.
Okay, thank you so much, sir.
Thank you.
सर एक लास्ट क्वेश्चन पूछना है।
Yes.
सर आपके पास कोई प्री रिकॉर्डेड प्रीव्यू वाले लेक्चर्स हैं क्या? बिफोर ज्वाइनिंग द सब्सक्रिप्शन आई वांट टू जस्ट सी गो थ्रू योर कंटेंट, कोई भी एक सैंपल वीडियो या कुछ।
ऐसी तो कंटेंट भी आज आपको आपको यूट्यूब पे मिल जाएंगे हमारे चैनल पर, बट यू कैन गिव अवर योर कॉन्टेक्ट डिटेल, so our team can provide you.
Okay sir, thank you sir.
Okay, thank you. Okay, Ranjam, can you wind up?
Yeah, sure, sir. Just wanted to ask, Naren, are you connected to any person or
hello,
from your
sir.
team who has given you this link?
Yes sir, Mrs. Nasreen, Miss Nasreen,
Nasreen,
someone.
right? So you
Yeah.
हाँ,
can
तो वो
you can
नसरीन को
ask
ही आप
Nasreen.
टेक्स्ट कर दो।
You can ask
Okay.
Nasreen. Nasreen will share the link of the demo class.
Okay sir. Okay sir.
Kind
Thank
of
you sir.
it was a master class of ours, so you can have a look into the faculty profile and the class as well from there.
Okay. Okay sir.
Hi, Dr. Yogesh.
हेलो सर, गुड मॉर्निंग। सॉरी सर, थोड़ा लेट हो गया।
Yes, Yogesh,
सर,
बताइए।
आई एम डूइंग इन माय इंटर्नशिप इन दिल्ली। आई passed my FMG exam in 2023. तो
Okay,
सर,
very good.
now I'm preparing for AMC exam. सर, so can you guide us कि सर पहले इंग्लिश का एग्जाम देना है या फिर कैसे क्या
नहीं,
करना है, थोड़ा
इंग्लिश
स्टेप
का
वाइज
नहीं है।
थोड़ा detail।
अभी आप दिल्ली में हो तो हमारा तो टीम दिल्ली शायद नेक्स्ट वीक आने वाला भी है, आप मिल सकते हो उनसे। तो इसमें क्या
So
है,
where?
इन जनरल मे बी ये आपका लिंक किसने दिया है, योगेश, किससे कनेक्टेड हो आप?
सर अभी तो व्हाट्सएप पे मेरे पास लिंक आया था, तो आई जॉइन दिस।
हाँ, तो वो उसमें नाम दिया हुआ होगा, उसमें किसी का नाम है क्या वो उस मैसेज में? ठीक है, वो उसी व्हाट्सएप पे आप रिप्लाई कर देना, ही और शी विल हेल्प यू। ठीक है, तो एएमसी में क्या होता है कि पहले डॉक्यूमेंटेशन हम लोग करते हैं। ठीक है, तो उसमें होता है एपिक वेरिफिकेशन होती है, वो हम करेंगे, आपका करवाएंगे। ठीक है, फिर होता है एएमसी पोर्टफोलियो, वो भी हम लोग करा देंगे आपका। फिर जो नेक्स्ट एग्जाम होता है वो एएमसी लिखना है। इंग्लिश की रिक्वायरमेंट नहीं होती है पहले, आप बाद में भी लिख सकते हो और पहले भी लिख सकते हो, इज अप टू यू। और इंग्लिश की प्रिपरेशन हम ही कराएंगे, आपकी ओईटी करना है तो या पीटी करना है वो भी हम लोग कराएंगे। आपको डॉक्यूमेंटेशन हम लोग कराएंगे, एएमसी पास कराएंगे और ये इंग्लिश भी हम लोग पास कराएंगे। उसके बाद आपको सीवी कैसे बनाते हैं, कवर लेटर क्या क्या कैसे एड्रेस करते हैं या क्वेश्चंस को जब वो जॉब में यहाँ पर मांगते हैं, हाउ टू प्रिपेयर योरसेल्फ फॉर द इंटरव्यू जॉब के लिए, वो और कौन कौन सी वेबसाइट से आपको जॉब ढूंढनी है, कैसे करना है, वो सारा का सारा हम लोग गाइडेंस देंगे आपको, जो भी एकेडमिकली को ज्वाइन करेगा। ठीक है
सर, कैन आई गेट मतलब लाइक हाउ दे आस्क द क्वेश्चन, लाइक क्वेश्चंस का पैटर्न कैसा होता है, कैसे होते हैं क्वेश्चन, थोड़ा सा हिंट मिल सकता है?
यस डेफिनेटली, यू कैन किससे भैया ने पूछा किससे कनेक्टेड हो आप? ये तो आपको बेसिकली इन जनरल आपको एएमसी वेबसाइट पे भी मिल जाएगा। एवन हमारी वेबसाइट पे बहुत सारे ब्लॉग हैं इसके ऊपर, आप वहाँ जाके भी आप चेक कर सकते हो। academically.com पे आप जाओ, वहाँ बहुत सारे ब्लॉग्स हैं एएमसी के ऊपर।
ओके
ओके
ओके सर, थैंक यू सो मच।
थैंक यू। Yes, guys, किसी का कोई और क्वेश्चन है और we can finish here.
Sir, there
Sir,
is
एक
one more question
last
I want to ask.
Yes,
If
बिल्कुल.
it's like अगर एक साल का या 2 साल का आपका क्लिनिकल गैप आ जाता है तो does it affect the CV?
Yes, definitely. अगर आपके पास में गैप है तो आपको जस्टिफाई करना है वाई गैप क्यों है वहाँ पर. तो आप स्टोरी बना सकते हो अपनी पर्सनल, जैसे कि फॉर एग्जांपल आपका शादी हो गया या कुछ प्रेगनेंसी थी या कुछ और फैमिली में कुछ इशू था, है ना, उसकी वजह से आपने गैप लिया फैमिली को सपोर्ट करने के लिए, दिस एंड दैट करके आपको स्टोरी बनानी होगी. अदरवाइज गैप नहीं दिखा सकते क्लिनिकल में बेसिकली, यू नो.
और सर आपकी ये फीस स्ट्रक्चर क्या है फॉर द
ये
थिंग्स
हमारे
यू आर
टीम
प्रोवाइडिंग?
ने लिंक दिया होगा ना, तो आप उस लिंक पे उनको रिप्लाई कर दो व्हाट्सएप पर. आई विल गिव यू द इन्फॉर्मेशन. ठीक है,
थैंक यू सो मच.
थैंक यू सो मच.
सर, इंडिया में आपका कोई ऑफलाइन सेंटर या फिर कोई आपके कुछ ऑफिस वगैरह है क्या? जैसे आप बोले थे दिल्ली आ रहे हैं, वैसे कहीं पे और कहीं पे है?
नहीं, दिल्ली में बेसिकली मैं अगस्त में आया था दिल्ली में. मैंने इवेंट किया था गुड़गांव के अंदर. कौन सा, कहाँ किया था रंदम हमने? वो एक होटल था
रेडिसन में.
रेडिसन, मुझे याद नहीं आ रहा. यस, रेडिसन ब्लू में हमने किया था ये गुड़गांव में. ठीक है. तो इन जनरल मैं तो ऑस्ट्रेलिया में रहता हूँ, हमारी कंपनी भी ऑस्ट्रेलिया में रजिस्टर्ड है. ठीक है, पर हमारी टीम जो है वर्क करता है वहाँ पर. इवन इफ यू वांट, दिल्ली में आप मिल सकते हो बेसिकली. दिल्ली में, चंडीगढ़ में हमारा स्टाफ है, या इन द इटसेल्फ इन कोलकाता. तो बेसिकली डिफरेंट डिफरेंट लोकेशंस में है ये लोग, ना. तो ऐसा कोई हमारा ऑफलाइन सेंटर नहीं है, बिकॉज इतने बच्चे मिलेंगे नहीं हम कहीं भी सेंटर खोलेंगे तो. एटलीस्ट 20-30 बच्चे हो तभी तो हम सेंटर खोल सकते हैं, राइट, एक सिटी के अंदर. उससे कम पे हम क्या सेंटर खोल पाएंगे? ये कोई ऐसा एग्जाम तो नहीं है लाइक नीट पीजी या कुछ बच्चे बहुत सारे मिल जाएंगे हम खोलें. तो हम लोग तो प्रिपरेशन ही कराते हैं यूएस असेंबली और प्लैब और एएमसी वाली. तो अभी ये हमने ऑफलाइन तो खोला नहीं है, ऑनलाइन ही है. तो हमारा अब अपना एलएमएस है, लर्निंग मैनेजमेंट सिस्टम, और हमारा जो मोबाइल एप्लीकेशन है एंड्रॉयड पर और आईओएस पर. तो उसी के थ्रू पूरी पढ़ाई होगी. और एक ये भी है कि जो फैकल्टी जो होती है हमारी, वो एग्जाम क्वालिफाइड की हुई होती है. अब जिसने एएमसी क्वालिफाइड कर लिया तो इंडिया में वो क्या कर रहा होगा? वो ऑस्ट्रेलिया जाएगा ना, तो फिर वो आपको कैसे पढ़ाएगा? तो एक ये भी रीजन है कि वो ऑनलाइन ही इसको हम लोग कर सकते हैं.
ओके सर, थैंक यू सर.
ओके, थैंक यू. ठीक है, आई थिंक अभी देयर इज नो मोर. लास्ट क्वेश्चन किसी का कोई है?
हाँ, yes,
लाल जी,
sir.
आपने कोई
Yes.
क्वेश्चन नहीं किया. यस योगेश.
Sir, where they are coming in Delhi? I mean, when? Within a week?
नहीं, आप उसको रिप्लाई कर दो, वो आपको बता देंगे. ठीक है, आप
Okay.
जिनने आपको लिंक दिया है ना, क्या नाम है उनका, व्हाट्सएप में आप
Nasir.
देखो. नसरीन ने दिया है ना?
Yeah.
ठीक है, वो नसरीन आपको बताएगी. ठीक है,
Okay. Okay.
ओके, थैंक यू.
Yogesh, can you please share your, phone number and your
आप उस
email?
व्हाट्सएप पे आप रिप्लाई कर दो नसरीन को. नसरीन ने दिया.
Yes,
Yes, ma'am.
yes. It
अभी
will be
करता हूँ मैं.
helpful for me. Okay.
I think so. We don't have any further questions.
ठीक है रंजन, देन ओके. थैंक यू सो मच गाइस.
Thank you, sir. Thank you.
थैंक यू, बाय.
Thank you, sir.
Thank you, sir.
Just a quick reminder: everybody should